The medical benefits of cannabis. One of the reasons you may be taking this course is to learn about a form of medical marijuana called CBD. CBD is shorthand for cannabidiol, which is a compound in cannabis that has medical effects but does not make people feel high. Medical marijuana also often contains an element called THC, which is the chemical compound in marijuana that will get you high. Some people only want CBD products. Others respond to a combination of CBD and THC working together, while still others embrace the pain-relieving high effects of THC. THC, by the way, is shorthand for tetrahydrocannabinol. There are several ways that CBD can be consumed, and one of the most popular forms is liquid CBD drops, which you usually put under your tongue or add to food. There is also CBD gum, which is chewed and then absorbed sublingually. There are even CBD topicals, such as lotions and ointments, that you apply to affected areas. You will even find edible CBD products, such as gummies. And yes, we will cover cooking with CBD later in the course. Because each state has its own rules and regulations regarding hemp, recreational, and medical cannabis, you'll have to research your own local state requirements. To research your own state and its specific requirements, start with normal.org, NORML.org. In terms of medical cannabis, you will find that some states offer flower or bud to patients, while others offer edibles, and some provide oils only. So you'll need to dig in and find out what is unique about your state and its approach to medical marijuana. If you have a medical marijuana card, other states may recognize it. States with reciprocity include Arizona, Maine, Michigan, Nevada, New Hampshire, Pennsylvania, and Rhode Island. To keep up with legislation, we recommend you go to websites such as leafly.com and normal.org to track every state's cannabis activity. If you are interested in exploring the medical possibilities of cannabis, you should start by talking with your doctor. Of course, your doctor may not be sympathetic towards nor knowledgeable about cannabis, so you may have to find a doctor who specializes in medical cannabis. We know you may be thinking, how would I find a qualified doctor? We suggest that you ask friends and relatives for references, and that the following websites may also help you find a doctor: leafly.com and weedmaps.com. When you find a qualified doctor, here are some questions that you may want to ask. Is my condition a good candidate to be treated with cannabis? If so, what method of cannabis consumption would you recommend? What dose should I start with and use during my course of treatment? Is there a particular brand of cannabis product that I should look for? Is the cannabis product I use going to get me high? And what other effects should I be aware of? If you're using any other medication, ask if it will interact with cannabis. Am I eligible for a medical cannabis card? And can you think of any other question that I've neglected to ask you that's important? Another thing to keep in mind is that if you are in a state that allows medical marijuana, you will want to get a medical card for legal protection. Also, medical marijuana is almost always less expensive and sometimes more potent to allow for full medical benefits. If you are concerned about getting high, remember that not all cannabis products will get you high. So if this is a concern, be sure to ask, is there a cannabis product I can take that won't get me high and will still be effective?